Hi, good afternoon. Today we will be rationalizing your hematology nursing. Let's start. Number one, nurse must be aware of common diagnostic and laboratory tests for them to be effective care provider. The most accurate lab test to signify anemia is which among the following? So first, let's eliminate Dallas because platelet is has nothing to do with anemia, and let's eliminate B because MCV refers to the size of the RBC. So that leaves us to only A or C. The answer is letter C, hemoglobin count, because an RBC can exist in the body without hemoglobin. And if an RBC has no hemoglobin, it does not transport oxygen. So therefore, to make it simpler, you can still have anemia even if you have normal RBC because sometimes RBC does not contain hemoglobin. Okay. Next, number two. Which of the following clients would most likely develop anemia? Answer, Talas. Why? Because if you have chronic kidney disease, tendency there's a chance that you may have deficiency in what you call your erythropoietin. Sorry? Okay, you may have deficiency in erythropoietin. Okay? Erythropoietin is the one that, this is E. Erythropoietin is the one that stimulates. It's the one that stimulates RBC production. So erythropoietin comes from the kidney. Okay, so the answer is D. Next, number three. When teaching a group of clients about food rich in iron, nurse is correct if she states which of the following. Okay, so we all know that breast milk is a poor source of iron. Eliminate A. Corn soup is not a good source of iron. Answer, letter C, because omelette comes from egg, and egg is rich in iron. Okay, next, number four. Client with aplastic anemia developed bruising. As a nurse assigned to this patient, which intervention is appropriate to implement at this time? So the patient with aplastic anemia, you all know that the patient with aplastic, a patient who has aplastic anemia has decreased mababang kanilang RBC. They have deficiency in WBC and they have deficiency in platelets. So the patient develops anemia. The patient is prone to infection, and of course, the patient may present bleeding tendencies. And we all know that one of the um, intervention to prevent bleeding is Boston, padding side rails. Okay, so that's the best answer because of the word bruising. So the patient is manifesting sign and symptom of bleeding tendencies. Next, number five. A nurse's care for a client with aplastic anemia. Which of the following action of the nurse is most important? A. Morning care. B. Turning client. C. Washing hand. Or D. Monitoring for shortened APTT result. So the patient have aplastic, like I said. So the best answer here is Letter C. Because like I said, these patients are prone to infection. Next, number 16. Which clients will most likely suffer from vitamin B12 deficiency? A. Patient with painless bleeding. GI bleeding. B. An adult with history of smoking. C. A woman with ileostomy. Or D. Client with cleft palate. So the answer is letter C. Why? Because vitamin B12 is absorbed. I repeat, vitamin B12 is absorbed in the ileum. So if your patient have ileostomy, tendency is we all know that the stool of patient who have ileostomy is liquid. So instead of being absorbed by the ileum, your vitamin B12 goes out along with the stool through your ileostomy. So there's a chance that the patient will develop vitamin B12 deficiency. Next, number 7. During interview of a client's laboratory test result, the nurse is aware that test particularly it measures your RBC size. Keyword RBC size. Answer letter A. Your MCV. MCV will measure your size of your RBC. Normal size is between 86 to 91 micrograms. 86 to 91 micrograms. Reticulocyte, hematocrit, and erythrocyte. This is for your letter D is to detect presence of inflammation. So eliminate D. Hematocrit refers to RBC concentration. So eliminate C. The letter B, reticulocyte count refers to the number of immature RBC. Therefore, answer is A. Next, number 8. The nurse is monitoring a child who has undergone bone marrow transplant. Which assessment, if observed by the nurse, indicates complication? Answer, Boston. After bone marrow transplant, assess your patient for if your patient developed the following: jaundice, ascites, right upper quadrant pain, they indicate your VOD, or what you call your veno occlusive disease. Your veno occlusive disease. This is the this is the permanent closure of hepatic vein. Permanent closure of hepatic vein. The answer is Boston. Next. Next. Number 9. An assessment finding common to clients with hemolytic anemia is A. Fatigue, B. Jaundice, C. Paresthesia, and D. Cyanosis. First, let's eliminate A because fatigue is common to all anemia. Let's eliminate C because this is only seen on patient who have vitamin B12 deficiency. So that leaves us to only B, or D? Answer, Boston. Jaundice. Why? Because in hemolytic anemia, there are three hemolytic anemia. We have your sickle cell, we have your G6PD deficiency, and we have your thalassemia. All of these are subtypes of hemolytic anemia, and all of them will manifest jaundice. What else? They will manifest bone pain or bone enlargement. Bone pain or bone enlargement. Your jaundice, kaya tayo nagkaka-jaundice is secondary to increase in bilirubin level. Kaya tayo may jaundice. Okay? Saan galing yung bilirubin? Galing yan sa RBC na na-hemolyze. Okay? The answer is jaundice. Next. Number 10. Which of the following instruction by the nurse to a client with sickle cell anemia is appropriate? So we all know that in sickle cell anemia, if the RBC is exposed to low oxygen, there's the RBC shape changes into elongated. Nagiging ganito yung itsura ng RBC. Therefore, between A, B, C, and D, ang chance na bumaba yung oxygen is letter C. Kaya C is the answer. Because high altitude, low oxygen. C is the answer. Next. And student asks you why clients with kidney problem develop anemia. Nurse is correct if she states A, because the kidney produces RBC. No, it's your bone marrow that produces RBC. B, because kidney secretes renin, which prolong RBC life. No, renin has nothing to do with RBC. C, because bone marrow responds to kidney. Or D, because kidney stores iron. No, the liver is the one that stores iron. The answer is letter C. Next. Number 12. Client with iron deficiency anemia complain of dysphagia. Nurse would anticipate the doctor to perform pulmonary function test, order Schilling's test, endoscopy, or prescribe iron. The answer here is letter C. Perform endoscopy. Expect the doctor will perform endoscopy because if a patient with IDA develop dysphagia, there is a chance that dysphagia is due to a formation of what? What you call your esophageal web. Esophageal web. Patient with iron deficiency anemia sometimes form a a a thin tissue in the esophagus. It looks like a web, spider web. Can cause dysphagia. Okay, so the answer there is the doctor will confirm if there is esophageal web, and how the doctor will confirm is to insert an endoscopy. Okay, the answer is letter C. Next. Number 13, a client is to receive liquid iron. Nurse should teach client mother to take iron on empty stomach. B. Take iron with vitamin B12. C. To use straw. Or D. Report allergy. We will report allergy if the iron is in IV form. So eliminate D. Answer letter C. Why? This is to prevent staining. Prevent staining of the teeth. The answer is letter C. Next. Number 14. The nurse is assessing a client with history of anemia. Client states that she is experiencing numbness on his extremity. Based on this, client is most likely suffering from which type of anemia? There's only one anemia that will manifest numbness, paresthesia, and other neurologic symptom, and that is your vitamin B12 deficiency, which is a type of letter D, megaloblastic anemia. D is the answer. Next. Number 15. Doctor ordered epogen alpha to be given to a client with ESRD. Nurse is aware that this drug is needed by the client because it, answer, does. Epogen alpha is a synthetic erythropoietin. It stimulates the bone marrow to produce RBC, therefore, it will increase circulating RBC. D is the answer. Next. Which among the following best show iron deficiency anemia? The answer here is, if they're asking about the best indicator of iron deficiency anemia, that would be Dallas. Ferritin is the stored iron. Stored iron. Therefore, if your stored iron is decreasing, that means you are not or you have deficiency in iron. That's why you're using the stored iron already. D is the answer. Next. Client diagnosed with vitamin B12 deficiency comes to the clinic due to dizziness and balance problems, which history of the client most likely cause the client's anemia. Smoking does not cause anemia. Chemotherapy may cause anemia, but uh, this will cause what? Aplastic anemia. But aplastic anemia doesn't have any problem in the balance. Or it does. Aplastic anemia is not related to vitamin B12 deficiency. So eliminate B. So answer is letter C. Why? Because when you say gastrectomy, there's a removal of stomach. And stomach is the one that secretes what you call your intrinsic factor. In this intrinsic factor is necessary for vitamin B12 absorption. Therefore, the answer is letter C. If you don't have the stomach, you don't have intrinsic factor, you can't absorb vitamin B12. Next, number 18. Which among the following is least expected to be seen on iron deficiency anemia? IDA has glossitis. Eliminate A. Eliminate B. Eliminate D. Letter C is the answer. Because chronic or clubbing of finger is seen on patient who has chronic hypoxia. Although IDA may have clubbing of fingers, but it's the least because IDA can be detected early as possible and it can be treated um, in a very short time. So the answer is letter C because letter C is long term because it's chronic. Next, number 19. Nurse Ryan is assigned to a client with hemolytic anemia. Which intervention by Ryan is appropriate for this client? First, letter C is for aplastic anemia. So eliminate C. B is for vitamin. I know. Yeah, it's for vitamin B12. Although B6 yon, so malayo. It's not B. A or D. Answer letter A. Because patient, like I said, who has hemolytic anemia, develop what you call your bone pain. So And letter E is for pain management. A is the answer. Next, number 20. Which physiologic change manifests an adaptation to hemolytic anemia? Answer, thallus, bone enlargement. Next, number 21. Which lab data is expected to be seen on clients with hemolytic disease? Like I said, A, elevated ESR is for what? Inflammation. Prolonged APTT is for bleeding patient, bleeding tendencies. So C or D? Answer, letter C. Because of hemolysis, there's increased bilirubin. This is due to hem- hemolysis. Next, for 22, nurse is conducting health teaching to a group of mothers with children suffering from sickle cell disease. Nurse is correct in discussing the cause of disease if she states A, both parents should have the disease for the child to acquire. Very good. A is the answer. Because sickle cell is a autosomal recessive. If a certain disease is an autosomal recessive, both parents should have the disease for it to be passed to the child. Next, or I'm sorry, the answer is Dallas. Okay, both parents should be carriers, not both parents should acquire because um it doesn't needed for the parents or both parents is not needed to have both the disease. They just need to be carriers. If both parents are carriers, it will be passed to their child. Dallas is the answer, not A. I'm sorry, it's D. Okay. Next. Next, 23. Which of the following intervention, if done by the nurse, indicates understanding of severe pernicious anemia? Severe pernicious anemia. So there is a deficiency in vitamin B12. If there's vitamin B12 deficiency, there's a nerve problem, especially coordination. And patient have problems with balance. Therefore, letter C is the answer. Because in the nurse assisting a client on ambulation knows that the client have problem with balance. C is the answer. Next. Number 24. Client with vitamin B12 deficiency had sprained his ankle. Client asked for possible intervention from the nurse. All but one is a possible or indicated to this client. So we're looking for except. Answer, Boston. Why? Because only cold will reduce edema, not warm. B is the answer. Next. Number 5. Which group of clients would most likely develop vitamin B12 deficiency? Let's eliminate women and children. Answer, letter C, elderly, because there is what? In elderly, there is, I'm sorry, it's not hyper, it's atrophy. There's atrophy of stomach cells. And if there's atrophy of stomach, there's decreased secretion of intrinsic factor. If there's decreased secretion of intrinsic factor, there's a decreased absorption of vitamin B12. Okay. Oh, I'm sorry. I naghang. Okay. Tuloy ko lang yung sinasabi ko. If there's decrease in intrinsic factor, There is absorption, decreased absorption of vitamin B12. So the answer here is C. Next, number 26. Schilling's test is done for patient with vitamin B12 deficiency. Nurse is aware this is done mainly to answer Boston. The Schilling's test is used to classify or to determine which cause of vitamin B12 deficiency. Because the causes of vitamin B12 deficiency can become from diet or it can come from malabsorption. So your Schilling test will determine if the problem is diet or malabsorption. Next, number 27. Client scheduled to undergo Schilling's test asks the nurse about the procedure. Nurse needs further teaching if she states which of the following: A says use radioactive. This is true. So this is not the need for further teaching. B is also true because they will collect urine and they will test if it's radioactive. The answer is letter C because if a procedure uses a radioactive substance, it's considered invasive. Next. Next, number 28. Which one of the following type of anemia is alcoholism a risk factor? Answer: Dallas. Because alcohol increases folic acid requirements. Answer is Dallas. Next, number 29. Client with chronic kidney failure may develop anemia due to which pathophysiologic change? A. Increased waste product that destroy the RBC. No. Waste product does not destroy RBC. B. Edema formation causes splenomegaly, and so splenomegaly may affect RBC, but not to the point that it may cause anemia. Answer: letter C. Because if patient well kidney failure doesn't have any erythropoietin, there's no stimulation of RBC production. Remember, erythropoietin is the one that stimulates RBC production. C is the answer. Next, number 30. A nurse is reviewing about parenteral injection of iron. She is correct if she states the best way to give iron is answer. Remember that IM is the least preferable. Least. Sub Q, we do not use sub Q as a iron injection. So the answer is A or D. Since there are two IV, A or D is the answer. It's not B. It's your least desirable. It's either A or B. Next. Or should I say A or D, not B? Okay. Next. Number 31. Which of the following is the most common cause of iron deficiency anemia among adult male and menopausal women? If this is the question in the board exam or any foreign exam, you should answer Boston. GI bleeding. This is the most common. Okay, B is the answer. Next. Iron deficiency anemia is also common among children mainly because of answer Boston. Helminthiasis or your parasitic worms. We all know that if a person have parasites, the nutrients is being taken by the worm instead of being absorbed by the body. B is the answer. Next. Number 33. Nurse is reviewing the chart of one of the patient in the ward. What lab result in the chart supports diagnosis of IDA? So, when you say iron deficiency anemia, it tends, or iron deficiency anemia is manifested by small RBC. That's why we call iron deficiency anemia is also called micro microcytic. The normal size of RBC is between 81 to 96 micrograms. Therefore, the answer is letter C. This means the RBC is small. It is congruent to iron deficiency anemia. Next, number 34. The client in the same ward was diagnosed of megaloblastic anemia. The nurse anticipate that the client's laboratory will manifest which of the following? Pancytopenia is seen on patient who has, sorry, aplastic aplastic anemia. Okay, so eliminate A. B, eliminate because increased hematocrit does not indicate anemia. It does not indicate anemia. So it's either C or D. Answer letter C. Because like I said, the normal size of RBC should be between 81 to 96. If the RBC is less than 81, it's microcytic. If the RBC is larger than 96, it means it's a large RBC. That's why we term it megaloblastic anemia. Because megaloblastic means, it means large RBC. Okay? So all patient who has megaloblastic anemia will have a large RBC. There are two megaloblastic anemia, vitamin B12 deficiency and folic acid deficiency anemia. Okay? Next. Number 35. Client who suspected aplastic anemia was admitted for evaluation. The nurse knows that the diagnostic procedure the doctor may order is which of the following? Answer. We all know that aplastic anemia is a disorder of the bone marrow. Therefore, the diagnostic test should be something that would check the bone marrow, and the answer is letter A. Next. Number 36. Mando, 48-year-old client with aplastic anemia, is being cared for by a group of nurses. Which order by the doctor would prompt the nurse to clarify? Answer. Boston. Why? Because diet as tolerated means patient can eat anything, which is wrong. Because a patient has aplastic anemia should avoid fresh fruits, fresh food, fresh vegetable, because they contain microorganisms. And we all know that anemia, aplastic anemia has decreased RBC, decreased WBC, I should say. So patient who has aplastic anemia is prone to infection. So B is the answer. You need to clarify. Okay? Next. Number 37. Client is to undergo bone marrow transplant to treat his aplastic anemia. Prior to the procedure, nurse expect the client to receive. So the patient will undergo bone marrow transplant. Your patient is to undergo bone marrow transplant. The doctor will try to eradicate your remaining bone marrow so that there will be a space for the new bone marrow. And for the doctor to be able to eradicate your remaining bone marrow, the patient will undergo chemotherapy. Okay? This will destroy the remaining bone marrow. This will what? Create space for the new bone marrow. The answer is letter A. Next. Number 38. Client in sickle cell crisis was admitted. IV was hooked. O2 was started. Which of the following order will you expect to add? So the answer is very obvious. The answer is C, because sickle cell crisis main sign and symptom is pain. So the patient needs analgesic. C is the answer. Morphine. Next. Number 39. Patient with thalassemia expressed concern about chelation therapy. She asked the nurse what is the purpose of it. Nurse responded by saying, so thalassemia patient needs to they undergo chronic bone blood transfusion. So in the long term, this patient receives blood transfusion every month for a very long time unless a bone marrow donor is found. But if there is no bone marrow available, the patient will undergo blood transfusion every month. And if in the long term, repeated blood transfusion, poses the client to iron toxicity. That's why this client undergo chelation therapy to remove or to prevent iron toxicity. Okay, to remove iron in the body. The drug they use is called deferoxamine. Deferoxamine. The answer is A. Next, group of clients are being educated by Nurse Irene. One client volunteered to repeat the teaching of the nurse. The client needs further instruction if she stated that A. Plastic anemia is due to premature destruction. A is the answer. We're looking for need for further instruction. A is need for further instruction because a plastic anemia is not a hemolytic anemia. It's not hemolytic anemia. Premature destruction of RBC is the definition of hemolytic anemia. Okay? Like I said, there are only three hemolytic anemia: sickle cell anemia, thalassemia, and G6PD deficiency. Okay? All of these are correct. B, C, and D are all correct. Next. Which of the following must be included in the care plan when caring for a client suffering from splenic sequestration crisis? When we say splenic sequestration crisis, the main symptom, the main symptom is shock. Therefore, you need to letter A. Monitor BP. Next. Okay, number 42. Which of the following is the drug of choice? Drug of choice for patient experiencing pain secondary to sickle cell crisis. We do not use NSAID and aspirin for sickle cell crisis pain because this is a severe pain. Answer: Dallas. Demerol is contraindicated to children with sickle cell because Demerol can cause seizure. They can induce seizure to children. So we use morphine. Okay? Next. The structure in the body responsible for the stimulation of RBC production is, of course, letter A, kidney. Kidney will stimulate the bone marrow to produce RBC. RBC is destroyed by your spleen if the RBC is greater than 120 days. Sisirain na siya ng spleen. Okay? Next. Number 44. When studying RBC, nurse note that the normal size of RBC is, answer, Boston. Normal size. The test that will measure the size of the RBC is your MCV, which means mean corpuscular volume. B is the answer. Next. Number 45. Platelets are fragment that originates from Boston. Megakaryocytes. Your megakaryocytes will rupture and form your platelet. Okay. Stem cell is the source of all blood cells. Okay. Erythrocyte is RBC. So it's not D, it's not A. Boston is the answer. Next. Number 46. Which electrolyte is necessary for normal clotting mechanism? Answer: Boston. Because calcium is needed to activate. It is needed to activate your clotting factors. B is the answer. Next. The site of clotting factor production is located at which origin? Answer: Boston. Liver. That's why all patients who has liver disease are prone to bleeding because clotting factors are being produced in the liver. Okay. Next. If an RBC was formed in the absence of iron, it is expected to be, answer, Boston, smaller because an RBC without iron has no hemoglobin. You need iron so that you can attach hemoglobin to the RBC. So it's smaller. Okay, next. Now, number 49. If an RBC was formed in the absence of folic acid, RBC expected to be, this time the answer is letter C, larger. That's why if you have folic acid deficiency, you develop megalo, megaloblastic anemia. C is the answer. And number 50, the average lifespan of RBC, we all know is, letter C, 120 days. Okay, so I hope you got a lot of points. Okay, So this is the last part, and I just want to say thank you. Goodbye.